Hello, I am Dr. Manjunath Malige. On the eve of this World Diabetes Day, I would like to share a few interesting tips about diabetes. We all know that diabetes is extravagantly present in India, India being the second world capital of diabetes after China. Now, there are certain things that we need to learn as to why this is the case. Let us first look at why is it that we as Indians and South Asians in general are at increased risk of developing diabetes. The first and foremost factor is our genetic pool. As South Asians, like our friends in Africa and Afro Caribbean, we are at increased risk of developing diabetes because of our genetic predisposition when compared to our friends in Western Europe and America. Now, that in itself is a big risk factor. So much so that in the Western population, there is an increase of the risk of developing diabetes after the age of 40 years. But in India, we have increased risk of diabetes just at the age of 25 years. So you can see the difference by 15 years. That's a big jump. So any Indian who is 25 years or more should be aware of the possibility of diabetes, and it is advisable to get regular health checks to see whether by any chance they have developed diabetes. The second factor is family history. If you have a parent, a brother, sister, or a child who has diabetes, then your chance of developing diabetes is increased by 2 to 6 times. If you had a heart attack or a stroke, then your chances of developing diabetes is much higher. Now, women who have polycystic ovarian disease and pregnancy diabetes or gestational diabetes are also at increased risk of diabetes. Now, we know that diabetes is like a ticking time bomb, which is just a volcano waiting to erupt. The most important point to note is that you may not have any symptoms of diabetes even though you have diabetes already. So please don't wait for the diabetes to knock on your door. Get your regular health checks if you fall into any of these high risk categories as I have just mentioned, and tackle diabetes on the horns right from day one. Diabetes sometimes we see has been diagnosed 10 years actually after the original development of diabetes, because people are unaware of it because it hardly causes symptoms in some patients. In the clinic, I see patients regularly who are less than 30 years of age with a new diagnosis of diabetes. Some of them, interestingly, are yet to get married and have already developed complications of diabetes in the form of kidney problems and heart problems. So I think it's time to wake up, make ourselves aware, and make sure that we manage our diabetes well. The three tips I would like to give is healthy diet, healthy weight, and regular exercise. This keeps diabetes at bay. Thank you.